If you do it right, it doesn't hurt. Now, what am I talking about? I'm talking about anal sex and all the worries, the fears, the misconceptions that come along with it. My name is Dr. Ava Remington, and I've been practicing sexual health medicine for over 20 years now. I've heard it all in my clinic, trust me. And one of the most common things I hear, especially from men over 50, is this: Doc, my partner won't even consider it. Okay, or I've always been curious, but I'm terrified of the pain. Or sometimes just, is this even normal for someone my age to want? And here's what I want you to know right off the bat. Every single one of those feelings is completely valid. You're not weird, you're not too old, and you're definitely not alone. I've sat across from thousands of patients in my career, men in their 50s, 60s, 70s, and beyond, and this topic comes up way more often than you'd think. The problem is, nobody talks about it openly. There's this wall of silence, and behind that wall, there's a whole lot of confusion, shame, and missed opportunity for genuine connection. So today, I'm going to give you 7 practical tips for approaching anal sex, whether it's your very first time or you've tried before and it didn't go so well. But before we get into the nuts and bolts, I want to talk about something that I think matters even more than technique, and that's communication. See, when your partner says no to anal sex, a lot of guys take that personally. They hear rejection. They think it means something about them, about their desirability, about the relationship. But in my 20 plus years of doing this work, I can tell you that a refusal almost never has anything to do with you. It's usually about fear of pain, fear of mess, fear rooted in old experiences or cultural beliefs that run deep. Sometimes it's simply that your partner needs more information, more reassurance, more time. And you know what? That's okay. That's not a roadblock. That's actually an invitation to go deeper. Not physically, I mean emotionally. The strongest relationships I've seen in my practice aren't the ones where both partners agree on everything. They're the ones where both partners feel safe enough to say, I'm scared, or I don't understand this, or can we talk about it? I remember early in my career, I had a patient, a retired firefighter from Baltimore, big tough guy, 72 years old. He came in and he could barely make eye contact when he brought this up. He said, Doc, my wife and I have been married 48 years. I love her more than anything, but there's this part of our intimacy that I've always wanted to explore, and I've never had the guts to bring it up. We talked for a long time that day, and what struck me wasn't the topic itself. It was how much courage it took for him to say those words out loud. That man taught me something I've carried with me ever since. Vulnerability isn't weakness. It's the price of admission for real intimacy. Whether you're 25 or 75, that never changes. So if you're watching this and you've been wanting to have this conversation with your partner, let me encourage you. Start there. Start with honesty. Start with, I've been thinking about this, and I'd love to talk about it when you're comfortable. Don't push. Don't pressure. Just open the door and let them walk through it on their own terms. All right, now let's get into the 7 tips. And I want you to really pay attention here because these aren't just suggestions. They're the difference between a good experience and a terrible one. Tip number 1, relax your body completely. This is the foundation of everything else I'm going to tell you. If your body is tense, if your muscles are clenched up, it's going to hurt. Period. The anal sphincter is a muscle. Actually, it's 2 muscles, an internal one and an external one. The external sphincter is the one you can consciously control, the one you squeeze when you're holding it in. The internal sphincter is involuntary. It does its own thing. And here's the key. When you're anxious or nervous, both of those muscles tighten up. It's your body's natural defense mechanism. So the very first thing you need to do is get your whole body into a state of relaxation before anything happens. Take a warm bath. Do some deep breathing. Put on some music that calms you down. Choose a position that feels comfortable and natural. And for God's sake, don't rush it. This isn't a race. There's no clock. Listen to your body. If something doesn't feel right, slow down or stop. You're in control, always. Now, here's something a lot of people ask me about, especially guys who are on the larger side. I get this question all the time. Doc, I'm pretty well endowed. Is this even going to work? And the honest answer is yes, but it requires even more patience and preparation. Size does make a difference. I'm not going to sugarcoat that. If your partner is dealing with a larger than average situation, the gradual approach I'm about to describe becomes absolutely critical. Don't skip steps. Don't assume that what works in other contexts is going to work here. Take your time, communicate constantly, and be willing to stop if your partner needs you to. Tip number 2, watch out for cross-contamination. This is a big one, and I can't stress it enough. Anything that goes into the anus, whether it's fingers, toys, or a penis, should never go directly into the vagina or the mouth without being thoroughly cleaned first. I'm talking soap and warm water, or switching to a fresh barrier. The bacteria in the rectum are completely different from what belongs in other parts of the body, and transferring them can cause serious infections, urinary tract infections, bacterial vaginosis, and worse. This isn't about being squeamish, it's basic hygiene, and it protects both you and your partner. Make it a habit. Clean everything before switching areas every single time. No exceptions. Tip number 3, use condoms. I know, some of you are thinking, but Doc, I'm in a committed relationship. We've been together for decades. I hear you. But here's the thing. The rectal lining is thinner and more delicate than vaginal tissue, which means it's more susceptible to tiny tears. Those micro tears create entry points for sexually transmitted infections. Even in a long-term monogamous relationship, using a condom during anal sex is smart practice. It also makes cleanup easier, and if you want to switch from anal to vaginal penetration, you absolutely must change the condom. Don't even think about going directly from one to the other. New condom, every time. This is non-negotiable from a medical standpoint. Tip number 4, lubricate, and then lubricate some more. I will never get tired of saying this. The anus does not produce its own lubrication the way the vagina does. Going in without proper lubrication is the number one reason people have painful experiences and then never want to try again. Use a good quality lubricant and use a lot of it, more than you think you need, then add some more. Now, here's the practical breakdown. If you're using condoms, which I just told you should be, stick with water-based lubricant. Oil-based lubes will break down latex and compromise the condom. Silicone-based lubricants last longer and feel smoother, but they can damage silicone toys, so keep that in mind. A lot of condoms come pre-lubricated, but I'm telling you right now, that tiny amount is nowhere near enough for comfortable anal sex. Always add extra. Keep the bottle within arm's reach because you're probably going to need to reapply. Tip number 5, use toys to work your way up gradually. If you're a beginner, trying to go straight to full penetration is like trying to run a marathon without ever jogging around the block first. It's going to end badly. Instead, start small. Start with a single, well-lubricated finger. Get comfortable with that sensation. Then try 2 fingers. Take your time. There's no schedule here. When you feel ready, you can move to purpose-built anal toys like small plugs or anal beads. These are specifically designed to help the muscles gradually accommodate and relax. Start with the smallest size and work your way up over days or even weeks. And remember everything I said about cleaning. Wash those toys thoroughly before and after use. And never go directly from anal use to vaginal use without proper cleaning. This gradual approach is especially important for older adults. As we age, our tissues become less elastic, and the muscles may take a bit longer to relax and stretch. That's completely normal. It just means you give yourself extra grace and extra time. Tip number 6, take care of your hygiene beforehand. Let's talk about the elephant in the room. One of the biggest fears people have about anal sex is the mess, and I get it. Nobody wants to deal with an embarrassing moment in the middle of intimacy, but here's the reality. A little preparation goes a long way. The simplest thing you can do is go to the bathroom an hour or 2 before. That takes care of most of it. If you want to be extra thorough, you can use a small anal douche or bulb syringe to gently rinse the lower rectum with warm water. But, and this is important, don't overdo it. Excessive douching can irritate the rectal lining and actually make things worse. If you've never used one before, try it a few hours ahead of time so you know how your body responds. And after the encounter, clean the area gently with warm water and a mild pH-balanced cleanser. Your body will thank you. Now, I want to add something here that wasn't in the original playbook but comes directly from questions I hear from my patients all the time. A lot of guys ask me, Doc, what's What's actually happening inside the body during anal penetration? Why does it feel the way it feels? And I think understanding the anatomy takes away a lot of the fear. So here's the quick version. The rectum is about 6 to 8 inches long, and it naturally has some curves to it. The walls are lined with mucous membrane, which is sensitive but also quite resilient when treated gently. The nerve endings around the anal opening are dense. That's why the area can be both pleasurable and sensitive to pain. For men specifically, the prostate gland sits right in front of the rectal wall, and stimulation of the prostate can produce intensely pleasurable sensations. That's not a secret, it's anatomy. And when the sphincter muscles are properly relaxed and there's adequate lubrication, penetration should not cause sharp pain. Pressure, yes. A feeling of fullness, yes. But sharp shooting pain means something is wrong, either not enough lube, not enough relaxation, or moving too fast. If that happens, stop, readjust, add more lubricant, and try again only when you're ready. Tip number 7, and this might be the most important one. Know your own body first. Before you bring a partner into this experience, spend some time exploring on your own. I mean it. This isn't just my suggestion. It's what I prescribe to my patients. Use your own fingers or a small toy and get familiar with the sensations. Figure out what feels good, what doesn't, what angle works, how much pressure is comfortable. This self-exploration does 2 critical things. First, it gives you a baseline understanding of your own body so you can communicate clearly with your partner about what works and what doesn't. Second, it takes a lot of the anxiety out of the partnered experience because you've already been there. You know what to expect. You're not going in blind. And I want to say something specific to the older gentlemen watching this. I know that for a lot of you, this kind of self-exploration might feel unfamiliar or even uncomfortable as a concept. Many of you grew up in an era when these things simply weren't discussed. But I've been doing this work for over 2 decades, and I promise you, knowing your body is not something to be embarrassed about at any age. It's an act of self-care. It's responsible. And honestly, it leads to better experiences for both you and your partner. All right, we've covered a lot today. Let me bring it all together. Anal sex, like any form of intimacy, starts in the mind. It requires trust. It requires communication. And it requires a willingness to be vulnerable with another person. The 7 tips I've given you today: relaxation, avoiding cross-contamination, using condoms, generous lubrication, gradual preparation with toys, proper hygiene, and self-exploration. These aren't just mechanical steps. They're a framework for treating yourself and your partner with care and respect. I've been in practice for over 20 years, and if there's one thing I've learned, it's that great intimacy has no age limit. It doesn't expire at 50 or 60 or 80. It evolves, it deepens, and sometimes it means trying something new together, even when it feels a little scary, especially when it feels a little scary. Because that's where growth happens. That's where you discover things about yourself and your partner that you never knew were there. So play, explore, communicate, and above all, have fun with it. Good sex at any age is built on 3 things: trust, communication, and a healthy sense of humor. If something goes sideways, laugh about it together. That's what real intimacy looks like. I'd love to hear from you. Drop a comment below and tell me, have you tried any of these tips? Are you considering exploring this for the first time? What questions do you still have? I read every single comment, and I'm here to help. If this video was useful to you, give it a thumbs up. Share it with someone who might need to hear this, and subscribe to the channel so you don't miss the next one. I put out new content every week on sexual health, relationships, and living your best life at every age. Take care of yourselves, gentlemen. And remember, intimacy and pleasure are fundamental parts of a healthy, fulfilling life. It doesn't matter how old you are. Don't ever stop exploring, learning, and connecting with the people you love. I'm Dr. Ava Remington, and I'll see you in the next video. Big hug to all of you.